And every president says they do, and every president doesn't.
Joy, I understood that one of the conditions of health care reform was that we would not lose any of benefits. People wouldn't lose benefits. It seems to me that there's quite a lot of difference in the abortion issue of not funding abortions for women in prison and not funding abortions in Medicaid. That I can kind of understand. But to insist on it in the exchange for thousands and thousands and thousands of people, that because there's a federal subsidy, I don't think that's right. And the reason I don't think it's right is because I understand even some people who buy from the exchange don't even receive federal subsidy, right? I mean, that would be possible.
Yes, you can buy an insurance policy on the exchange and never receive a federal subsidy. Correct. Okay. And then you can buy a policy that has abortion coverage.
But
right?
there are not even riders. Why would a woman buy a rider? Because it's for an unplanned pregnancy anyway, and in most states it's not allowed. I mean, I think that it sounds really good, and I certainly believe people have the right to believe whatever they believe, but I think here we're dealing with a health care issue that is now going to be refused to thousands and thousands of working women and people who work for small businesses, and I don't think that's right. I mean, I don't have any quarrel. I don't think abortion is a good idea, but I do think people have the right to it. It's legal in our country, and it's sometimes probably very necessary, and I think people have that right, and I think that right is being taken away from them because of certain religious beliefs, and I don't believe that's right in this country.
Since the Hyde Amendment in 1977, Roe v. Wade was 72, 76 it came out when in effect was the Hyde Amendment. You do not use public funding to pay for abortion in any way, shape, or form. Now, underneath the Stupak Amendment, nothing changes.
Except for thousands and thousands and thousands
right.
of women
As you expand the role of the federal government,
They're not federal employees, right?
True. But let me finish. As you expand that, those prohibitions went with it. If they want to have a debate on abortion, I'm happy to have the debate on abortion. Don't put it in this health care bill.
That's my point, too.
Right. And we warned them well before they ever did it. Don't even do it. How did it get in? It wasn't the Stupak Amendment. It was the lowest caps amendment out of California. The Stupak Amendment was in to strip it back to keep current law. Even President Obama on September 9th said to his address before the nation, there will be no federal dollars for abortion. Even Senator Reid says there will be no federal. We'll keep current. We're not going to expand. We're not going to restrict. So keep the Hyde language there. Keep the Hyde language there. If you want to argue about it later, great. Remember, we don't restrict the right. All we're doing, we're restricting who's paying for it. Take mental health. Take mental health. For years we fought to have mental health services in Medicare and Medicaid. It's not in there. Not every benefit someone may want has to be paid for by the federal government. Oral health, great idea. Doesn't mean we're going to pay for it for everybody. So, the policymakers that they've thrown in our lap have always voted since '77 no public funding for abortion. And go ahead.
Well, why would a person buy a policy for abortions beforehand? I mean, I think it sounds good, but it's unrealistic. And it sounds to me like there are so many. You're extending the abortion denial to thousands and thousands of people.
We're extending current law. I mean, you're not going to say, okay.
I don't think you're extending current law.
Yeah, we are. Current law says no public funding for abortion. So if you're getting a federal subsidy, you can't use it to buy an abortion policy. That's what it is. Look at 18%, according to the Guttmacher Institute, 18% of the women who have an abortion have insurance. It's not an option that's used very often. I agree. No one plans on an unplanned pregnancy. The average abortion, they tell me, costs somewhere between, as I've heard, as low as $175, as much as $400, depending on what possible complications may be with the termination of the pregnancy. What 70, 82% of the women do who have it. They pay cash. And what we're saying as federal elected officials, if you want this benefit, we can't restrict it. Only thing we can restrict is we're not going to use our tax dollars to pay for it.